So you may have heard that they're going to get the autopsy results from a victim or a body. Well, what does that exactly mean? Well, here at Tobacco University with this video of Autopsy Basics, we're going to go over some of the background regarding autopsies. So first off, when an autopsy in general, basically it's an internal medical examination of a body used to determine the cause and circumstances of the death. That's the entire goal of performing or conducting an autopsy. Now, keep in mind that there are two different terms that sometimes used interchangeably, and they really shouldn't be. One is a medical examiner, and one is a coroner. A medical examiner is a government official, which is always a physician and often a forensics pathologist in charge with the investigating sudden and unexpected deaths or deaths from injuries. The coroner is an elected official with death investigation duties that signs the death certificate. So keep in mind these are distinctly different people. One's a government official, one's an elected official, and they have very distinctive and different backgrounds. So these terms should not be used interchangeably. Now, death is defined as, and this is what we're trying to determine here, the end of life, is to put it simply. It's characterized by stopping of blood circulation and brain activity. When the heart stops beating, oxygen is deprived from the body and the cells will begin to die at that point. Once enough cells die, life cannot be restarted. So we're looking at this is how we're defining death here. The goal of autopsies, so the whole point of providing them is to try to determine the manner of death, which is the means by which the person perished, the cause of death, which is the reason why they died, the mechanism of death, which is the specific body failure that may have occurred, and the time of death, which is referring to when the person actually died. Now, the manner of death, there's different categories it can be placed in. There could be natural, if this is caused or determined to be caused by disease, cancer, physical injury, stroke, or heart attack, and it occurred only or solely by those. Then there's accidental, if it occurs without apparent intent. There's suicide if caused by the deceased person or individual. Homicide is defined as if someone other than deceased caused it. And then we have suicide and homicide examples, such as shooting, burning, poisoning, hanging, drowning, or suffocation. These are all kind of manner of death categories that the autopsy could classify a death as. When we have causes of death, which there are many, and this is the simple reason why they died. We just see annually number of deaths caused in the world in 2016, right above me, with cardiovascular disease and cancers being at the very top of the list here. And we can kind of see everything else, again, projected all those numbers in millions of deaths annually, looking at the world population for the year 2016. We kind of have a little zoomed in version here, the top 10 global causes of death for 2016, again, expressed in millions of people. Then we get the mechanism of death. So what the mechanism of death here is we're trying to describe the specific change in the body that brought about the cessation of life. What was the method at which that occurred? If someone has been shot, they may have died from loss of blood, for example. Someone dies of a heart attack, they may die from pulmonary arrest. And if someone is strangled, they may die from asphyxiation. So this is looking at the mechanism of death. And here's a sample kind of death certificate just provided here, just so you can kind of get an idea of what's included there. And lastly, we have the time of death. So a lot of times forensic investigators are trying to estimate or determine what time this was. And this is simply when the person actually died. And this can help determine who to include or who to exclude based on alibis or location at a certain day or time. And that's why it's such a crucial part of the investigation process to try to determine and pinpoint that time of death. Even has to be estimated with as great degree of accuracy given the information that can be gathered and collected.